The porcelain coffee cup shattered against the floor like thunder, breaking through a prayer, and Maya Rodriguez knew in that split second that everything in her carefully controlled world was about to change forever. The man in the expensive charcoal suit was clutching his throat, his face cycling through shades of red that had no business existing on human skin. Around him, the morning crowd at Sunrise Diner sat frozen in their vinyl booths, forks suspended halfway to their mouths, newspapers forgotten in their laps. The air itself seemed to have thickened, carrying the weight of collective helplessness and the bitter aroma of coffee growing cold. Maya had been balancing 3 plates of Eggs Benedict on her left arm when she first noticed him, Dr. James Whitmore, according to the reservation book, though she knew him by reputation long before she knew his name. The city's most celebrated cardiovascular surgeon, the man who had pioneered 3 different heart procedures and owned a mansion that overlooked the harbor like a monument to precision and success. He came to the diner every Tuesday morning at exactly 8:47 a.m., ordered the same breakfast, 2 eggs over easy, wheat toast and black coffee, and left a $20 tip on a $15 meal. But now, Dr. Whitmore was dying, and the universe had placed Maya Rodriguez, a 28-year-old waitress with calloused hands and dreams she kept folded away like old letters, directly in the path of his crisis. The choking had started innocuously enough. Maya had been refilling his coffee when she noticed him pause mid-bite of his toast, his hand moving instinctively to his chest. She'd seen it before, the reflexive gesture of someone whose body was sending alarm signals faster than their mind could process them. What she hadn't expected was the way his eyes would find hers across the chaos of the morning rush, the way they would communicate a desperate plea that cut through every social barrier between them. "Someone call 911. The voice belonged to Margaret Chen, the diner's manager, a woman whose 30 years in the restaurant business had taught her to handle everything from grease fires to customers who tried to leave without paying. But this was different. This was medical, urgent, and completely outside her expertise. Maya set down the coffee pot with trembling hands, her mind already racing through possibilities. The nearest hospital was 15 minutes away on a good day, 25 in morning traffic. The paramedics would need at least 10 minutes to arrive, assuming they weren't already tied up with another emergency. Dr. Whitmore didn't have that kind of time. The way his lips were starting to turn blue, the panicked fluttering of his hands against his throat, Maya had seen enough medical dramas to know that oxygen deprivation could cause brain damage in as little as 4 minutes. But what the other patrons of Sunrise Diner didn't know, what Maya had never told anyone, including Margaret, was that her hands held secrets. For 6 years, she had studied every medical textbook she could afford, watched every surgical video available online, and practiced procedures on mannequins in the basement of the community center where she volunteered. Her father, before cancer took him when she was 22, had been a paramedic in their small hometown in New Mexico. He taught her to see the body as a machine with fixable parts, to understand that sometimes the difference between life and death came down to someone being willing to act when everyone else was paralyzed by fear. "Ma'am, you need to step back." A man in a business suit had approached Dr. Whitmore, his hands raised in the universal gesture of someone who wanted to help, but had no idea how. "I know CPR." Maya bit her tongue to keep from explaining that CPR wouldn't help when someone's airway was completely blocked. She watched Dr. Whitmore's face grow paler, watched his expensive watch tick seconds away from his wrist, watched the morning sunlight stream through the diner's windows and illuminate what might become a tragedy that would haunt everyone present for the rest of their lives. The Heimlich maneuver had failed. 2 different customers had tried it, their efforts growing more frantic as Dr. Whitmore's condition worsened. Maya could see the obstruction wasn't going to dislodge conventional methods. Something was lodged too deeply, too securely in his airway. The situation called for something more drastic, more precise, more surgical. Maya's mind flashed to her father's voice, steady and calm during those long nights when she was 16 and desperate to understand why the world seemed so randomly cruel to good people. "Sometimes, mija, you have to trust what your hands know even when your heart is terrified. The body wants to heal itself. It sometimes just needs someone brave enough to show it the way." She looked at Dr. Whitmore again, really looked at him. Beneath the expensive clothes and the reputation was just a man who had dedicated his life to saving others, now helpless in a crisis that required someone else to save him. The irony wasn't lost on her. The healer needing healing, the expert requiring the intervention of someone society would never consider qualified for such a moment. Margaret was on the phone with emergency services, her voice sharp with authority and fear. "Yes, we have a choking victim at Sunrise Diner on 4th Street. Adult male, approximately 50 years old. The Heimlich isn't working. How long until you can get someone here?" Maya couldn't hear the response, but she could read Margaret's face. Too long. Whatever timeline the dispatcher was giving her, it was too long. The diner had grown eerily quiet, except for the sound of Dr. Whitmore's increasingly labored breathing. Even the coffee machine seemed to have stopped its usual gurgling and hissing. Maya felt the weight of 24 pairs of eyes, all looking for someone to take charge, someone to fix what was broken. Her hands were steady as she untied her apron, steadier than they had any right to be. "I need everyone to step back," she said, her voice carrying an authority that surprised even her. "Margaret, I need the first aid kit and any sharp knives from the kitchen, clean ones." "Maya, what are you—" "There's no time to explain." Maya knelt beside Dr. Whitmore's chair, her fingers already assessing his pulse, the tension in his neck muscles, the specific way his breathing had become shallow and desperate. "Trust me, please." Margaret's eyes searched Maya's face for something: competence, confidence, hope. Whatever she found there must have been convincing, because she hurried toward the kitchen without another question. Maya placed her hand on Dr. Whitmore's shoulder, feeling the expensive fabric of his suit jacket beneath her palm. "Dr. Whitmore, can you hear me? I'm going to help you, but I need you to try to stay calm." His eyes met hers, and in them she saw something that nearly broke her resolve. Not just fear, but surprise. Surprise that the waitress who had been refilling his coffee was speaking to him with the calm authority of someone who might actually know what she was doing. The morning light streaming through the windows caught the silver threads in his graying hair, and Maya realized with a start that he looked vulnerable in a way that made her chest tighten. This wasn't Dr. James Whitmore, celebrated surgeon. This was just James, a man who might not see another sunrise if she didn't find the courage to do what needed to be done. Margaret returned with the first aid kit and a paring knife that gleamed under the fluorescent lights. Maya's hands didn't shake as she accepted them, though her heart was beating so hard she was certain everyone in the diner could hear it. "I need everyone to clear that table," Maya said, pointing to the nearest empty booth. "And I need someone to call Dr. Patricia Santos at Memorial Hospital. Tell her Maya Rodriguez needs her to talk me through an emergency cricothyroidotomy." The silence that followed was so complete that Maya could hear the clock above the cash register counting down the seconds. She could feel the weight of everyone's confusion, their fear, their desperate hope that maybe, somehow, the young woman in the white uniform and sensible shoes might know something they didn't. Dr. Whitmore's breathing had become almost inaudible. Maya's fingers found the pulse point on Dr. Whitmore's neck, and what she felt there sent a jolt of determination through her entire body. Weak, but still there, still fighting. "Patricia Santos," she repeated, looking directly at Margaret. "She's the head of emergency medicine at Memorial Hospital. Tell her Maya Rodriguez from the Community Center Volunteer Program. She'll remember me." Margaret was already dialing, her face pale but determined. Maya had never seen her manager move so quickly, and something about that urgency gave her strength. The next few moments unfolded like a choreographed dance of crisis and hope. Maya helped Dr. Whitmore lie flat on the cleared table, her hands gentle but decisive as she positioned his head to open his airway as much as possible. She could feel every eye in the restaurant watching her, could sense the collective held breath of people who had never witnessed anything more dramatic than an argument over a check. "Maya?" Margaret's voice cut through the tension. "Dr. Santos is on the line. She says to put you on speaker." The familiar voice of Dr. Patricia Santos filled the diner, warm with authority and concern. "Maya, I need you to tell me exactly what you're seeing." Maya's voice was steady as she described Dr. Whitmore's condition, using medical terminology that made several customers exchange surprised glances. She explained the failed Heimlich attempts, the visible obstruction, the timeline they were working with. "All right," Dr. Santos said, her voice carrying the calm confidence of someone who had talked people through medical emergencies before. "You know the procedure we practiced. Do you have everything you need?" "I think so." Maya's hands were moving even as she spoke, cleaning the paring knife with alcohol from the first aid kit, feeling for the landmarks on Dr. Whitmore's throat that would guide her incision. "Dr. Santos, I'm scared."
"I know you are, honey. But I've seen you practice this. Your hands know what to do. Trust them." Maya looked down at Dr. Whitmore, whose eyes were still open, still aware, still trusting her with his life. She placed her free hand on his forehead, a gesture that was both medical and deeply human. "Dr. Whitmore, I'm going to make a small incision in your throat to help you breathe. It's going to be okay." His hand found hers and squeezed once. Permission, trust, faith in the waitress who had served his coffee every Tuesday for 6 months and never mentioned that she spent her weekends learning to save lives. The incision was smaller than a penny, placed with a precision that came from hours of practice on medical simulation models. Maya's hands moved with the confidence of someone who had visualized this moment hundreds of times, even as her heart hammered against her ribs. The improvised breathing tube, a hollowed-out pen from Margaret's purse, sterilized with alcohol, slipped into place with an ease that felt like answered prayer. The sound of Dr. Whitmore's first clear breath through the tube was the most beautiful thing Maya had ever heard. Around the diner, the collective exhale was audible. Someone started crying, quietly, with relief. Margaret was still on the phone with Dr. Santos, but her voice had lost its sharp edge of panic. "Maya?" Dr. Santos's voice came through the speaker, warm with approval. "You did beautifully. The paramedics should be there any minute. You probably just saved his life." But Maya was looking at Dr. Whitmore's face, watching color return to his cheeks, seeing the gratitude and wonder in his eyes. This wasn't just about saving a life. This was about the moment when two people from completely different worlds discovered they were connected by something deeper than circumstance. The paramedics arrived 7 minutes later, their equipment and expertise taking over where Maya's improvised surgery had bought precious time. As they prepared to transport Dr. Whitmore to the hospital, he caught Maya's hand once more. He couldn't speak with the breathing tube in place, but he didn't need to. The question in his eyes was clear. "Who are you?" Maya squeezed his hand gently. "I'm just someone who believes everyone deserves a chance to keep living their story." As the ambulance pulled away, its sirens fading into the morning traffic, Maya stood in the doorway of Sunrise Diner and realized that her own story had just taken a turn she never could have anticipated. In the space of 20 minutes, she had crossed a line from observer to participant, from server to saver. And Dr. James Whitmore, the man whose life she had just held in her hands, was about to discover that the woman who had saved him was hiding depths that would challenge everything he thought he knew about talent, education, and the arbitrary barriers society built between the worthy and the overlooked. The shower in Maya's studio apartment had 2 settings, lukewarm and scalding, with no middle ground that resembled anything approaching comfort. At 2:47 a.m., 3 hours after her shift at the diner had finally ended, she stood under the barely warm spray and let the water wash away the lingering tremor in her hands that had started the moment the ambulance disappeared around the corner. Her bathroom mirror was cracked down the middle, a spiderweb fracture that split her reflection into two imperfect halves. Maya had grown used to seeing herself this way, divided, incomplete, constantly caught between the person she was and the person she dreamed of becoming. Tonight, the symbolism felt almost cruel. The apartment was a testament to careful budgeting and stubborn hope. Medical textbooks were stacked on every available surface, their pages flagged with sticky notes in a color-coded system Maya had developed to track procedures, medications, and anatomy. The kitchen table that doubled as her desk was covered with flashcards she'd made by hand, each one representing hours of study time stolen from sleep and social life. Above her bed, a map of the world was dotted with pushpins marking every medical school she'd researched but couldn't afford to attend. Maya had been 7 years old when she first told her father she wanted to be a doctor. They'd been sitting in the waiting room at the free clinic in Alamordo, New Mexico, watching her mother pace the linoleum floors while they waited for test results that would eventually confirm what they'd all been afraid to acknowledge. The lump in her breast wasn't going away on its own. "Doctors are special people, mija," her father had said, his weathered hands gentle as they smoothed her dark hair. "They carry other people's pain so those people can get better, but carrying pain is heavy work. You have to be very strong." Miguel Rodriguez had been strong enough to work 2 jobs after his wife's diagnosis, strong enough to drive Maya to school every morning before his shift at the auto shop, strong enough to help her with homework, even when exhaustion made his hands shake as he held her pencil. He'd been strong enough to encourage her dreams even when their own medical bills were drowning the family in debt they'd never escape. But strength, Maya had learned, wasn't always enough. Her mother lost her battle when Maya was 15. Her father lasted 7 more years before his own body betrayed him, the years of stress and overwork manifesting as the kind of aggressive cancer that specialized in stealing good men from families who needed them most. Maya had been a junior at the University of New Mexico, studying pre-med on a partial scholarship and working 20 hours a week at a campus coffee shop when the call came. By the time she made it home, Miguel Rodriguez was gone, leaving behind a daughter with half a degree, no family, and medical bills that would take her years to pay off even if she abandoned every dream she'd ever had.
Have the beat, the speed, and the strength, able to control the way that your energy or your rhythm is spread out over your life. So one of the things that I've learned is that when you have that control, you're not as reactive to the elements around you.
For the first time in years, Maya Rodriguez had a secret that felt like possibility instead of shame. Her morning routine was as precise as surgery itself. Shower at 5:45, coffee by 6, review of medical flashcards while she ate toast and honey. She'd developed the habit of starting each day by reading about procedures she'd never perform, memorizing medications she'd never prescribe, studying for tests she'd never take. It had become a form of meditation, a way of honoring the dreams she'd set aside without completely letting them die. But today felt different. Today, the knowledge felt less theoretical. Maya arrived at Sunrise Diner 45 minutes early, unlocking the door with keys Margaret had given her years ago when she'd proven herself reliable enough to trust with opening duties. The morning prep work was familiar and soothing, grinding coffee beans, checking the grill temperature, arranging napkins and silverware with the kind of attention to detail that made even mundane tasks feel purposeful. She was wiping down tables when Margaret arrived, carrying 2 cups of expensive coffee and wearing an expression Maya had never seen before. Not exactly serious, but thoughtful in a way that suggested important conversations ahead. "How are you feeling?" Margaret asked, settling into the booth where Dr. Whitmore had nearly died 12 hours earlier. Maya paused in her cleaning, considering the question carefully. "Different," she said finally, "like I've been walking around in clothes that were too small for me, and suddenly I'm wearing something that fits." Margaret nodded as if this made perfect sense. "Maya, I've been managing this place for 16 years. I've seen servers who could handle any customer, cooks who could work through any crisis, and employees who showed up every day no matter what was happening in their personal lives. But I've never seen anything like what you did yesterday." "I just did what needed to be done." "No." Margaret's voice was firm but not unkind. "What you did was medicine, real medicine, and you did it better than most people who went to school for 8 years to learn how." Maya felt her chest tighten. This was the conversation she had been dreading, the moment when her carefully constructed double life would have to be explained or defended or justified to someone whose opinion mattered to her. "Margaret, let me finish." Margaret held up her hand. "Dr. Santos called me this morning. Not the restaurant, me personally. She wanted to make sure I understood what kind of person I have working here." "Do you know what she told me?" Maya shook her head, not trusting her voice. "She told me that you've been volunteering at the community health center for 3 years, that you've assisted with more medical procedures than most nursing students, that you have a natural understanding of anatomy and physiology that impressed every doctor you've worked with." Margaret's voice grew softer. "She also told me that you've been paying off your father's medical bills for 6 years, and that's why you never went back to school." The silence that followed felt heavy with unspoken understanding. Maya found herself looking at the table where she had performed emergency surgery, remembering the weight of responsibility and the surprising steadiness of her hands. "Why didn't you ever tell me?" Margaret asked. "Because it doesn't matter," Maya said, the words coming out more bitter than she intended. "Dreams don't pay bills. Knowledge without credentials is just trivia. I'm a waitress who reads medical textbooks for fun. That's all." "Is it?" Margaret's eyes were kind but challenging. "Because yesterday you saved a man's life with knowledge that supposedly doesn't matter. Yesterday you were more of a doctor than some people who have the degree." Maya felt her tears threatening and forced them back. She'd had this argument with herself too many times to let hope sneak in now. "Margaret, I appreciate what you're trying to say, but Dr. Whitmore wants to meet with you." The words hung in the air between them like a question that hadn't been asked yet. Maya felt her world shift slightly off its axis. "He called the restaurant this morning," Margaret continued. "He's being released from the hospital this afternoon, and he wants to take you to lunch tomorrow to properly thank you. I told him you'd call him back." Maya's hands were shaking again, the same fine tremor that had started after the ambulance pulled away. "I can't."
"Why?" "Because..." Maya struggled to find words for the fear that was suddenly making it hard to breathe. "Because what if he asks me questions I can't answer? What if he wants to know why someone with my knowledge is working here instead of in a hospital? What if he tries to help me and then discovers I'm not worth helping?" Margaret reached across the table and covered Maya's hands with her own. What if he doesn't ask any of those questions? What if he just wants to say thank you to the woman who saved his life? Maya looked at her manager, really looked at her, and saw something in Margaret's expression that she'd never noticed before. Respect. Not the professional courtesy that existed between boss and employee, but the deeper respect of someone who had witnessed greatness and wanted to nurture it. "Maya," Margaret said gently, "what if this is the universe trying to give you back some of what it took away?" The morning rush started at 7:30, bringing with it the familiar chaos of orders and complaints and customers who needed their coffee exactly the right temperature at exactly the right time. But underneath the routine, Maya felt something new stirring, a sense of possibility that felt both terrifying and exhilarating.
For 6 years, she had been living in the space between who she was and who she dreamed of becoming. Yesterday, for 20 minutes, those two versions of herself had merged into someone capable of miracles. Maybe it was time to find out if that woman could exist for longer than an emergency. The restaurant chosen for their lunch meeting was the kind of place Maya had only seen through windows, crystal stemware catching afternoon light, servers who moved like ballet dancers between tables draped in white linen. The Meridian occupied the top floor of downtown's most prestigious office building, its floor-to-ceiling windows offering a view of the city that made everyday problems look small and manageable from 30 stories up. Maya had spent an hour getting ready, cycling through every outfit she owned before settling on the black dress she'd bought for her father's funeral. It was the most formal thing in her closet, though she suspected it would still mark her as an outsider among the Meridian's usual clientele. She had arrived 15 minutes early and spent the time in the lobby, watching people in expensive suits move through the marble space with the confident stride of those who belonged in places like this. Dr. James Whitmore looked different without the desperate pallor of someone fighting for breath. In the restaurant's elegant atmosphere, he seemed more himself, composed, authoritative, wearing success like a well-tailored jacket. The small bandage on his throat was the only visible reminder of yesterday's crisis, though Maya noticed he touched it occasionally, as if checking to make sure the nightmare was really over. "I have to confess," he said after they'd ordered, his voice slightly hoarse but gaining strength. "I've been researching you since yesterday." Maya's stomach dropped. "Oh. It's not what you think." His smile was gentle, almost apologetic. "I wanted to understand how someone with your skills ended up—" He gestured vaguely, and Maya knew he was trying to find a polite way to say serving coffee instead of practicing medicine. "Ended up as a waitress?" Maya finished for him, keeping her voice level despite the familiar ache of shame. "Ended up not in medical school," he corrected softly. "Because what you did yesterday, that wasn't luck or instinct, that was training, sophisticated training." Maya found herself telling him the story she'd never told anyone completely, about her pre-med studies, her father's death, the choice between education and honor that hadn't felt like a choice at all. She told him about Dr. Santos and the community center, about the textbooks and the midnight study sessions, and the dreams she'd been keeping on life support for 6 years. Dr. Whitmore listened without interruption, his expression growing more thoughtful with each detail. When she finished, he was quiet for a long moment, staring out at the city sprawled below them. "Your father was a paramedic in New Mexico." "Yes. Miguel Rodriguez. I looked him up." Dr. Whitmore's voice carried a weight Maya couldn't identify. 12 commendations for service, saved 43 lives in his career, died owing $180,000 in medical bills for cancer treatment that should have been covered by insurance. Maya felt her composure cracking. "How did you—" "Because I was curious about the family that could produce someone like you." His eyes met hers across the table. "Maya, I want to make you an offer." "There would be conditions," he explained, his tone careful and professional. "You'd work part-time in my surgical unit as a technician while you complete your studies. Consider it a practical education to supplement the theoretical. And after residency, you'd commit to 3 years at Memorial before you're free to pursue whatever specialty interests you." Maya stared at him, certain she'd misunderstood. "Dr. Whitmore, I can't possibly accept." "Why not?" "Because—" the words stuck in her throat. "Because it was too much, too generous, too good to be true. Because accepting help felt like admitting weakness. Because she'd spent so long building walls around her dreams that the thought of tearing them down was terrifying." "Because you don't think you deserve it?" His voice was gentle but challenging. "Maya, Yesterday, you performed emergency surgery with a paring knife and a ballpoint pen. You saved my life with skills you taught yourself and knowledge you acquired without any formal support. What exactly do you think you need to prove?" The waiter brought their meals, but Maya couldn't focus on food. Her mind was racing through possibilities and obstacles, hope and fear colliding in ways that made it hard to think clearly. "The debt," she said finally, "my father's medical bills, would be paid off as part of the arrangement." Dr. Whitmore's tone suggested he'd anticipated this objection. "Maya, I make more money in a month than most people see in a year. Funding your education isn't charity, it's investment. Investment in someone who has already proven she can save lives." Maya felt tears threatening again, but this time they weren't born of frustration or grief. They were the kind of tears that came with sudden, overwhelming possibility, the emotional equivalent of stepping from a dark room into bright sunlight. But underneath the gratitude was something else, a nagging voice that whispered about pride and independence, about the difference between earning something and having it given to you. Maya had spent 6 years defining herself as someone who didn't need rescue, who could handle whatever life threw at her through sheer determination and careful budgeting. "I need to think about it," she said, though every cell in her body was screaming yes. Dr. Whitmore nodded as if he'd expected this response. "Of course, take all the time you need. But Maya," he leaned forward slightly, his expression serious, "don't let pride cost you the future you've been preparing for your entire life." The next 2 weeks passed in a blur of internal debate and external pressures that Maya had never anticipated. Word of the diner incident had somehow reached the local news, despite her efforts to avoid interviews. The story had taken on a life of its own, growing in the telling until Maya found herself described as everything from a guardian angel to a medical miracle worker. The attention was overwhelming and unwelcome. Reporters called the restaurant looking for quotes. Strangers approached her on the street to share their own medical emergencies or to ask if she was really the hero waitress from the news. Margaret had been forced to hire temporary security after someone tried to follow Maya home from work. But it was the reaction of her regular customers that surprised Maya the most. Mrs. Patterson, who came in every morning for oatmeal and orange juice, had started bringing her medical questions along with her breakfast order. Could Maya look at this rash on her arm? What did she think about her new blood pressure medication? Was it normal for her arthritis to hurt more when the weather changed? Tom Bradley, a construction worker who usually ordered the breakfast special in gruff monosyllables, had quietly mentioned that his wife was scheduled for surgery and asked if Maya thought the hospital they'd chosen was any good. When Maya offered to research the surgical team for him, his eyes filled with tears of gratitude that he tried to hide behind his coffee cup. Even young Jennifer Walsh, the art student who came in most afternoons to sketch and drink coffee, had started showing Maya her drawings, not for critique, but as if Maya's opinion suddenly carried weight beyond her previous role as someone who refilled cups and took orders. The shift in dynamics was subtle but profound. Maya realized that her customers had never seen her as just a waitress. They'd been interacting with her as a person all along, someone whose intelligence and care they had noticed and valued even when she hadn't recognized it herself. The emergency with Dr. Whitmore had simply given them permission to express what they had already felt. But not everyone was supportive.
"So now you think you're a doctor?" The voice belonged to Rita Kowalski, a registered nurse who worked nights at the county hospital and came to the diner for breakfast most mornings after her shifts. Maya had always respected Rita's experience and dedication, but today there was an edge to her tone that made other customers look up from their meals. "I never said that," Maya replied quietly, refilling Rita's coffee cup with steady hands. Performing surgery without a license is illegal, you know. Doesn't matter if it worked out this time. What happens next time when you're in over your head and someone dies? The diner had grown quiet, except for the sizzle of eggs on the grill and the distant hum of traffic outside. Maya could feel the weight of attention, the way conversations at nearby tables had paused while people waited to see how she would respond. "I did what I had to do to save someone's life," Maya said, keeping her voice calm despite the anger building in her chest. "If you were in my position, what would you have done?" "Called for backup. Waited for the professionals." Rita's voice carried the authority of someone who had seen medical emergencies go wrong. "There are protocols for a reason." "The protocols weren't fast enough." "This time," Rita shot back. "But what about next time? What happens when some other customer has a heart attack and they look to you instead of calling 911? You're not trained for this kind of responsibility." Maya felt the familiar frustration of being caught between worlds, too knowledgeable to be dismissed, but lacking the credentials to be fully accepted. She understood Rita's concerns, even shared some of them, but the criticism stung because it echoed her own deepest fears about overstepping boundaries she had no official right to cross. "Rita," Margaret's voice cut through the tension as she emerged from the kitchen, her expression diplomatically neutral, but her tone firm. "Maya saved a man's life. I think we can all agree that was the right thing to do." "This time," Rita repeated stubbornly, "but setting precedent like this." "There was no precedent," interrupted Dr. Patricia Santos, who had just entered the diner and caught the tail end of the conversation. "There was a medical emergency, and someone with the knowledge and courage to act appropriately responded. That's not precedent, that's heroism." Maya felt her cheeks burn with embarrassment as the entire restaurant's attention focused on the impromptu debate about her actions. She'd never wanted to be the center of this kind of scrutiny, had never asked for her split-second decision to become a public discussion about medical ethics and professional boundaries. Dr. Santos approached the counter, her presence bringing a kind of medical authority that shifted the entire atmosphere of the conversation. "Rita, I've been a practicing physician for 15 years. I've seen plenty of people freeze up in emergencies, including some with more training than Maya has. What she did required not just knowledge, but judgment and skill under pressure. Those aren't qualities you can teach in a classroom. But she's not licensed." "Neither was the Good Samaritan," Dr. Santos replied calmly. "Rita, I understand your concerns about protocol, but Maya didn't perform surgery in a hospital setting where protocols exist. She performed life-saving first aid in a restaurant where the alternative was watching someone die." Maya appreciated Dr. Santos's support, but the debate was making her increasingly uncomfortable. She didn't want to be defended like a controversial medical procedure. She didn't want her actions analyzed and justified by people who hadn't been there, hadn't felt the weight of Dr. Whitmore's life in their hands. "If you'll excuse me," Maya said quietly, untying her apron. The alley behind Sunrise Diner smelled like garbage and car exhaust, but it was private and quiet, and blessedly free of people who wanted to debate the ethics of her emergency medical intervention. She pulled out her phone and stared at Dr. Whitmore's contact information. He'd given her his personal number along with his offer, told her to call when she'd made her decision. The generous proposal sat in her mind like an unopened gift, something beautiful and transformative that she was afraid to touch. The back door opened, and Margaret stepped into the alley, carrying 2 cups of coffee and wearing the expression she usually reserved for difficult conversations with suppliers. "Rita's gone," Margaret said, offering Maya one of the cups. Dr. Santos is handling the customers, and everyone's pretending the last 10 minutes didn't happen. Maybe Rita's right, Maya said, accepting the coffee gratefully. Maybe I am setting a dangerous precedent. Maybe next time someone will expect me to handle something I'm not qualified for, and someone will get hurt. Margaret was quiet for a moment, sipping her coffee and watching a stray cat pick through the dumpster with single-minded determination. "You know what I think the real problem is?" she said finally.
What? I think you're scared that if you accept Dr. Whitmore's offer, you'll have to admit that you've been selling yourself short for 6 years. And admitting that means acknowledging how much you've sacrificed, and how much you've lost, and how unfair all of it has been. Maya felt her chest tighten. Margaret had a way of cutting straight to the heart of things that was both comforting and terrifying. "I think," Margaret continued, "that it's easier to stay angry at the world for not recognizing your potential than it is to take the risk of actually pursuing it again. Because what if you try and fail? What if you're not as good as you think you are? What if you invest everything in this dream and it doesn't work out?" "What if it does work out?" Maya asked quietly. "What if I become a doctor and then spend the rest of my career wondering if I earned it or if it was just given to me by a grateful patient?" "Does it matter?" Margaret's voice was gentle but challenging. "Maya, your father was a paramedic who saved 43 lives. Do you think any of those people cared whether he learned his skills in a formal program or from experience on the job? Do you think their families questioned whether he deserved to wear the uniform?" Maya thought about her father, about the way he'd approached every emergency call with the same careful competence, whether it was a heart attack or a car accident or someone's child who'd stopped breathing. Miguel Rodriguez had never worried about whether he deserved the responsibility of saving lives. He'd simply accepted that he had the knowledge and the opportunity, and that was enough. Dr. Whitmore isn't offering you charity. He's offering you a chance to become officially what you've been unofficially for years. The only question is whether you're brave enough to take it. Maya's phone buzzed with a text message. Dr. Whitmore. "Maya, I hope you're still considering my offer. I wanted you to know that I've spoken with the Dean of Admissions at the medical school. They're willing to give you credit for your volunteer work and self-study. You could potentially complete your degree in 3 years instead of 4. No pressure, but I thought you should know all your options." Maya stared at the message, feeling the walls she'd built around her dreams beginning to crack. 3 years instead of 4 meant less time away from earning income, less time feeling like she was starting over, less time between her current life and the future she'd been imagining for so long. "Margaret," she said slowly, "what if I'm not ready for this? What if you are ready? What if you've been ready for years and just haven't had the opportunity to prove it?" The afternoon shift change brought Maya back inside, but the earlier confrontation had left her feeling exposed and uncertain. She moved through the familiar routines of serving customers and cleaning tables, but her mind was elsewhere, cycling through possibilities and fears in endless loops. Around 3 p.m., a familiar figure walked through the door. Dr. James Whitmore, looking more casual than she'd ever seen him in jeans and a polo shirt, took a seat at his usual table and smiled when Maya approached him with the coffee pot. "I hope you don't mind me stopping by," he said as she filled his cup. "I was in the neighborhood, and I realized I never properly thanked you for lunch the other day." "You don't need to thank me for anything," Maya replied, though she was pleased to see him looking healthy and rested. "Actually, I do." His voice took on a more serious tone. "Maya, I want to tell you something about the day you saved my life, something I haven't told anyone else." Maya felt her pulse quicken. "What?" "I was conscious through most of it. I heard everything you said to Dr. Santos, heard how you described my condition, how you explained the procedure you were going to perform, and I knew, even in that moment when I couldn't breathe, couldn't speak, I knew I was in the hands of someone who understood exactly what they were doing. Maya's throat felt tight. "Dr. Whitmore." His voice took on a more serious tone. "I've been practicing medicine for 25 years. I've worked with residents, fellows, attending physicians, and some of the best surgeons in the country. And I'm telling you that your medical knowledge and instincts are better than most people who have spent 8 years in medical school." Maya looked around the diner, at the familiar faces of customers who had become a part of her daily routine, at the worn vinyl booths and the coffee-stained counters that had been her world for 6 years. For the first time, instead of feeling trapped, she felt grateful. Grateful for the experience, for the people, for the lessons in human nature that would make her a better doctor when she finally had the chance. "If I accept your offer," she said slowly, "everything changes."
"Everything changes if you don't accept it, too," Dr. Whitmore replied. "The question is whether you want to change toward your dreams or away from them." Maya thought about her father, about the pride in his voice when he used to tell people his daughter was going to be a doctor. She thought about Dr. Santos and the trust she'd shown by teaching Maya procedures that most people learned in medical school. She thought about Margaret, who had just spent 20 minutes in an alley helping her understand that self-worth wasn't something that could be given or taken away. It was something that had to be claimed. "Dr. Whitmore," Maya said, her voice steady for the first time in weeks, "I'd like to accept your offer." His smile was radiant with approval and something that looked like relief. "Maya, you've just made the best decision of your life." As Maya finished her shift that afternoon, she felt the strange sensation of moving through familiar motions for what might be the last time. Tomorrow, she would give Margaret her 2 weeks' notice. In a month, she would be back in medical school, this time with the support and resources she'd never had before. But tonight, she was still Maya Rodriguez, waitress at Sunrise Diner, serving coffee and taking orders and listening to the everyday stories of people who had become more than customers over the years. Tonight, she was saying goodbye to the woman she'd been while preparing to become the woman she'd always known she could be. The transition wouldn't be easy. Medical school was demanding under the best circumstances, and Maya was starting at 28 with 6 years of interrupted education behind her. She would be older than most of her classmates and would have to prove herself in an environment where she'd always felt like an outsider. But she would also be entering medical school with something most students lacked: real-world experience with human suffering, with the weight of responsibility, with the understanding that medicine wasn't just science, but also compassion. She knew how to work under pressure, how to connect with people from all walks of life, how to find strength when everything seemed impossible. Most importantly, she knew that she belonged there. As Maya locked up the diner that night, she paused to look at the table where she'd performed her first real medical procedure. In the soft light from the street lamps outside, the scratched formica surface looked almost sacred, a place where lives had intersected, where knowledge had met opportunity, where a waitress had become a healer. Tomorrow would bring new challenges, new opportunities, new ways of defining herself and her place in the world. But tonight, Maya Rodriguez was exactly where she needed to be, exactly who she needed to be, ready to step into the future she'd been preparing for her entire life. Maya's first day of medical school arrived with the kind of September clarity that made everything look possible. Crisp air, golden light, and the sense that the world was starting over. She stood outside the brick and glass facade of the University Medical Center,
watching students stream past with backpacks and coffee cups and the eager nervousness of people beginning important journeys. At 28, Maya was older than most of her classmates, but she wasn't the oldest. The woman standing next to her, also staring up at the building with a mixture of awe and anxiety, looked to be in her mid-30s. "Second career?" she asked, extending her hand. "I'm Jennifer Walsh, former investment banker, current terrified pre-med student." Maya smiled, accepting the handshake. "Maya Rodriguez, former waitress, also terrified." "Waitress?" Jennifer's eyebrows rose. "How did you get from serving coffee to medical school?" It was a question Maya had been asked dozens of times over the past month, and she still hadn't found a completely satisfying answer. The story of Dr. Whitmore and the emergency surgery felt too dramatic, too much like something from a television show. But the deeper truth, that she'd been preparing for this moment for 6 years while serving breakfast to people who never suspected her dreams, felt too complicated to explain in casual conversation. "Long story," Maya said diplomatically, "but I'm here now, and that's what matters." The first week of classes was a blur of orientation sessions, textbook purchases, and the kind of information overload that Maya hadn't experienced since her undergraduate years. She discovered that medical school was both exactly what she had expected and completely different from what she'd imagined. The science was familiar: anatomy, physiology, pathology, pharmacology. Maya found herself in the strange position of already knowing much of the material from her years of self-study, but learning it again in a more structured, comprehensive way. Her professors began to notice that she asked unusually sophisticated questions, that she seemed to grasp concepts more quickly than students with traditional pre-med backgrounds. Dr. Elizabeth Chen, who taught anatomy, approached Maya after class on Friday of the first week. "Ms. Rodriguez, could I speak with you for a moment?"
Maya felt the familiar flutter of anxiety that came with unexpected attention from authority figures. "Of course. I've been teaching medical anatomy for 12 years, Dr. Chen said, her expression thoughtful. Most first-year students struggle with the complexity of the material, especially the cardiovascular system. But you seem to have an intuitive understanding that goes beyond textbook knowledge. Have you worked in healthcare before?" Maya hesitated, unsure how much of her background to reveal. "I've done some volunteer work in community health settings." "What kind of volunteer work?" "Assisting with basic procedures, health screenings, first aid training, nothing formal." Dr. Chen nodded slowly. "Would you be interested in working as a teaching assistant for the first-year anatomy lab? It's unusual for us to offer TA positions for first-year students, but your grasp of the material is exceptional." Maya felt a familiar surge of imposter syndrome. "Dr. Chen, I appreciate the offer, but I'm not sure I'm qualified." "Ms. Rodriguez, part of medical education is learning to recognize your own competence. False modesty isn't helpful to you or your future patients. You clearly understand anatomy at an advanced level. The question is whether you're willing to help your classmates learn it too." That afternoon, Maya called Dr. Whitmore to tell him about the TA offer. His response was immediate and enthusiastic. "Maya, that's extraordinary. TA positions for first-year students are virtually unheard of. Dr. Chen obviously sees something special in your understanding of anatomy." "I'm worried I'm moving too fast," Maya admitted. "What if I'm not really as prepared as everyone thinks I am? What if I'm fooling myself about my abilities?" "Maya," Dr. Whitmore's voice was patient but firm. "Do you remember what you told me the day you saved my life? You said everyone deserves a chance to keep living their story. Well, this is your chance to keep living yours. Don't let fear convince you to make yourself smaller than you are." Maya accepted the TA position, and within 2 weeks she was leading study groups and helping classmates understand concepts that seemed to come naturally to her.
The work was rewarding in ways she hadn't anticipated, not just intellectually, but emotionally. There was something deeply satisfying about helping other people grasp ideas that would eventually help them save lives. But it was during her third week of medical school that Maya's past and present collided in a way that would change everything. She was in the hospital cafeteria, grabbing coffee between anatomy lab sessions, when she heard a familiar voice behind her. "Maya? Maya Rodriguez?" Maya turned to find Rita Kowalski, the night shift nurse from the county hospital who had confronted her at the diner weeks earlier. Rita was wearing scrubs and looked tired in the way that suggested a long shift, but her expression was curious rather than hostile. "Rita?" Maya said, feeling suddenly self-conscious about her medical school ID badge. "Hi. So it's true. You're actually in medical school." Rita's voice carried a note of surprise that might have been admiration. "I heard rumors, but it's true." Rita was quiet for a moment, studying Maya with the assessing gaze of someone who was reassessing everything they thought they knew about a situation. "Maya, I owe you an apology. You don't—" "Yes, I do." Rita's voice was firm. "What I said at the diner about protocols and training and staying in your lane, I was wrong. Not about the importance of proper training, but about you. I let my frustration with the healthcare system make me judge you unfairly." Maya felt her defenses rising. "Rita, I understand your concerns. I really do. The line between helping and overstepping, there is no line when someone is dying." Rita interrupted. "I've been thinking about that morning for weeks, and you know what I realized? I was jealous." "Jealous? Jealous that you had the courage to act when it mattered and the knowledge to act correctly. Jealous that you knew more practical medicine than some people I work with who have nursing degrees. Jealous that you were getting recognition for doing exactly what healthcare workers should do, put patient care above everything else."
Confrontation. Not hostility, but exhaustion. The kind of bone-deep tiredness that came from years of working in a system that demanded perfection while providing insufficient resources and support. Rita, you've been a nurse for how long? 15 years. Started as an LPN, went back to school for my RN when my kids were in high school. I've seen more medical emergencies than I care to count. And in 15 years, have you ever frozen up in a crisis? Rita's laugh was rueful. More times than I'd like to admit. That's what made your response so remarkable. You didn't freeze. You didn't defer to someone with more formal training. You just did what needed to be done. I was terrified, Maya admitted. I almost talked myself out of acting at all. But you didn't. And that's what separates real healthcare providers from people who just have the credentials. Rita paused, then continued more quietly. Maya, I've been talking to Dr. Santos about you. She told me about your volunteer work, about how you've been preparing for medical school while working full-time. I had no idea. Maya felt the familiar discomfort that came with having her struggles acknowledged by someone who had initially been critical of her actions. Dr. Santos also told me about your father, about the medical bills and why you had to leave school. Maya, my husband died 5 years ago from complications after surgery. The bills nearly bankrupted me. I understand what it means to have the healthcare system fail someone you love. The conversation shifted something fundamental in Maya's understanding of her place in the medical community. Rita's apology wasn't just about the confrontation at the diner, it was an acknowledgement that Maya belonged, that her path to medicine might be unconventional, but it was valid. Rita, would you be willing to talk to my class sometime about what it's really like to work in emergency medicine? Rita's face lit up with surprise and pleasure. You'd want me to do that? I think my classmates could learn a lot from someone with your experience. The textbooks don't teach you how to handle the emotional weight of medical emergencies, or how to work with limited resources, or how to connect with patients who are scared and vulnerable. I'd be honored. That conversation became the first in a series of guest lectures that Maya organized for her anatomy class. She brought in Dr. Santos to talk about community medicine,
Marguerite to discuss patient interaction and bedside manner, and even Tom Bradley, the construction worker from the diner, to share his perspective as someone who had navigated the healthcare system as a patient. Dr. Chen was impressed by Maya's initiative in organizing the lectures, but it was the response from Maya's classmates that truly surprised her. They were hungry for the kind of real-world perspective that Maya was providing, eager to understand how their textbook knowledge would translate into actual patient care. "Maya," her classmate Jennifer Walsh said after one of the lectures, "how do you know all these people? It's like you have this whole network of healthcare connections that none of the rest of us have." Maya realized that her years at the diner, her volunteer work at the community center, her father's legacy as a paramedic, all of it had given her something that couldn't be taught in medical school. She understood healthcare from every angle, as a provider, as a patient family member, as someone who had navigated the system from positions of both knowledge and powerlessness. The recognition came gradually, then all at once. Dr. Whitmore started inviting Maya to observe surgeries, noting that her understanding of cardiac anatomy was exceptionally advanced. Dr. Santos recommended her for a summer research position studying community health interventions. Dr. Chen asked her to co-author a paper on innovative teaching methods in medical anatomy education. But it was during her first practical exam that Maya truly understood how much she had learned and how much she still had to learn. The exam was designed to test students' ability to apply anatomical knowledge to clinical scenarios. Maya was assigned a simulated patient, an actor trained to present specific symptoms, and asked to conduct a basic examination and provide a preliminary diagnosis. The patient was a middle-aged man complaining of chest pain and shortness of breath. As Maya began her examination, checking vital signs and listening to heart sounds, she noticed something the scenario hadn't explicitly mentioned: a slight irregularity in the man's pulse that suggested an actual medical issue rather than simulated symptoms. Maya paused, unsure whether to address what she was observing or stick to the scripted scenario. The examining professor, Dr. Marcus Webb, noticed her hesitation.
"Miss Rodriguez, is there something wrong?" Maya made a split-second decision to prioritize patient care over exam protocol. "Dr. Webb, I think this gentleman might be experiencing actual cardiac arrhythmia. His pulse is irregular in a way that seems beyond what would be simulated for the exam." Dr. Webb approached and checked the patient's pulse himself, his expression growing serious. Within minutes, the simulated patient was being escorted to the emergency department for evaluation of a previously undiagnosed heart condition. Later, Dr. Webb found Maya in the hallway outside the exam room. "Ms. Rodriguez," he said, his expression a mixture of amazement and respect. "In 30 years of teaching medicine, I have never seen a first-year student identify a real cardiac emergency during a simulation. Your diagnostic instincts are extraordinary." Maya felt her cheeks flush. "I just noticed something seemed off about his pulse rhythm." That something off was atrial fibrillation that could have led to a stroke if left undiagnosed, Dr. Webb continued. "The emergency department confirmed your assessment. You may have prevented a serious medical event." 3 years later, Dr. Maya Rodriguez graduated summa cum laude from medical school. She completed her residency in emergency medicine at Memorial Hospital, where she became known for her exceptional diagnostic skills and for her ability to remain calm under pressure. True to her promise, Maya established the Rodriguez Community Health Center in honor of her father, where she trained community members in basic medical skills while practicing emergency medicine. Dr. Whitmore served on the board of directors of the center, often remarking that the best investment he'd ever made wasn't in the stock market, but in the waitress who had saved his life with a paring knife and unwavering courage. Maya kept a photo from her last day at Sunrise Diner on her office wall, a reminder that sometimes the most extraordinary journeys begin in the most ordinary places, and that healing hands can emerge from anywhere when they're guided by knowledge, compassion, and the courage to act when it matters most.
Maya Rodriguez's journey to medicine began with tragedy and love. Her father, a paramedic, died when she was young, but not before teaching her to recognize cardiac arrhythmias and instilling in her a deep understanding of emergency medicine. This early education would prove prophetic, though Maya didn't know it at the time. After his death, Maya found herself working at Sunrise Diner, serving coffee and supporting herself while secretly pursuing medical knowledge through self-directed study. She spent years reading medical textbooks, learning anatomy, and developing expertise that far exceeded what anyone expected from a waitress. Yet she felt trapped, unsure how to bridge the gap between her passion and her circumstances. Maya's life transformed during a routine shift at the diner when Dr. James Whitmore, a prominent cardiothoracic surgeon, suffered a medical emergency. While others panicked, Maya immediately recognized the symptoms of a cardiac event. With no medical equipment available, she made the extraordinary decision to perform emergency surgery using a paring knife from the diner's kitchen. Her quick thinking and precise knowledge of anatomy saved Dr. Whitmore's life. This single act of courage revealed to everyone, including Maya herself, that she possessed not just theoretical medical knowledge, but the practical skills and instincts of a natural physician. Dr. Whitmore's recovery led to Maya's admission to medical school, but the transition wasn't seamless. During her first year, she encountered both skepticism from classmates and professors who questioned her unconventional background. However, her abilities continued to shine through. In a pivotal moment during a simulated medical examination, Maya identified an actual cardiac arrhythmia that others had missed, demonstrating once again her exceptional diagnostic instincts. Dr. Webb, the examining professor, was astounded. In 30 years of conducting medical examinations, he had never seen a first-year student recognize a real medical emergency during a simulation. This moment marked a turning point. Maya began receiving recognition not as an anomaly, but as a genuinely gifted medical student. Maya's journey was supported by a network of people who recognized her potential.
Margaret, her former boss at the diner, had always seen Maya's true calling. Dr. Patricia Santos, who ran a community health center, became a mentor and advocate. Even patients like Tom Bradley and his wife Sarah provided encouragement and perspective on what it meant to be truly caring healthcare provider. Roberto Sanchez, her father's former paramedic partner, offered perhaps the most meaningful validation. He reminded Maya that her father had always recognized her healing hands and would be proud of her path. This connection to her father's legacy helped Maya understand that her calling to medicine wasn't new. It had been there all along. Initially drawn to cardiothoracic surgery like Dr. Whitmore, Maya gradually discovered that her true strength lay in emergency medicine. Her background in crisis management, community health understanding, and ability to make rapid decisions with limited resources made her ideally suited for trauma medicine. Dr. Whitmore himself recognized this, encouraging Maya to consider emergency medicine over cardiac surgery. He understood that the goal was never for her to become him, but to become the best version of herself. Maya's unique combination of technical skills and real-world emergency experience positioned her to excel in trauma settings, where split-second decisions and resourcefulness were essential. By her second year of medical school, Maya had evolved from observer to active participant. She worked as primary student assistant in complex cardiac surgeries, developing the kind of professional synchronicity with Dr. Whitmore that came from months of collaboration. Her technique improved dramatically, and she gained the confidence that came with knowing she truly belonged in operating rooms and emergency situations. Each successful surgery reinforced that the woman who had performed emergency procedures with kitchen utensils could excel in the most sophisticated medical environments. Maya no longer questioned whether she belonged. She knew she did. Maya's experiences led her to develop a comprehensive vision for her medical career that went beyond traditional practice. She planned to specialize in emergency medicine and trauma surgery, but with a broader mission of community health education and empowerment.
Her vision included establishing a clinic that would bridge the gap between professional healthcare and community self-care. This facility would offer basic medical training for community members, advanced workshops for deeper medical knowledge, medical advocacy training to help people navigate healthcare systems, support groups for families dealing with medical crises, and chronic disease self-management education. Maya's approach was revolutionary in its fundamental belief that medical knowledge belonged to everyone, not just people with expensive educations and professional credentials. Her own journey from self-taught waitress to medical student proved that barriers to medical knowledge were often artificial and unnecessary. Her training program at the Community Health Center had already demonstrated success, with graduates going on to save lives using skills Maya had taught them. These programs became models for other cities, showing the practical impact of democratizing basic medical education. Maya's return to Sunrise Diner as a near graduate represented the completion of her transformation. The physical space remained unchanged, but her relationship to it had evolved completely. Where she once felt trapped, she now felt grateful. Where she once saw limitations, she recognized preparation. Margaret's insight proved prophetic. Maya had always been a doctor. She just needed the right opportunity to prove it. The diner had taught her essential skills that formal medical education couldn't provide: reading people's needs, staying calm under pressure, treating everyone with dignity, and understanding that medicine was fundamentally about human connection. Maya's story was ultimately about recognition, not just the recognition she received from others, but her growing recognition of herself as the doctor she had always been, even when she was serving coffee and taking orders, even when she was studying alone, even when others doubted her path. The knowledge, instincts, and calling had been there all along, waiting for the courage to act and the opportunity to serve.